Good morning. This is Dr. Famuyiwa of Montgomery Fertility. So I made a video a few months ago about ureaplasma, and that generated a lot of questions from patients. And I want to tackle one of them today. The question that came up is, what is the ideal treatment for it? I see a lot of people have been treated and they keep getting the infection. The problem is ureaplasma is a gram-positive organism that does not have a cell wall. So it cannot be treated by antibiotics that target the cell wall of the bacteria. And that means you can't really treat it with penicillin, which works by attacking the cell wall. You need an antibiotic that works against either preventing protein replication or inhibiting DNA. It could be bactericidal, meaning kills it off, or bacteriostatic, meaning slows down the growth. So the most common antibiotics that fall in that category for ureaplasma would be what are known as the macrolide antibiotics or the fluoroquinolones. The most common one usually used to treat it is doxycycline. Can you use azithromycin? You have to be a little careful. The problem is this bacteria is very, very smart, has its own internal AI, and it's highly resistant to a lot of the antibiotics out there. So if you look at the resistant profile, there was a study done in China actually, where they studied 163,000 patients over a span of about 5 years, and they found that doxycycline, and there's another one called pristinamycin, which I don't know we have here, maintained a very low resistance profile. And then as you start to go up higher, such antibiotics such as azithromycin, clarithromycin, erythromycin, ofloxacin, ciprofloxacin, very, very, very high resistance rate. Ciprofloxacin, which is a very good antibiotic, is a fluoroquinolone. There's a lot of resistance by the bacteria to ciprofloxacin, as well as ofloxacin. So I really wouldn't use those as a first line of treatment. The bacteria is too sensitive, some to moxifloxacin. You could use that, but you have to make sure you really want to use that because it does have some side effects, such as what is known as a QT prolongation in your EKG. It can cause tendon rupture and may damage cartilage if given to children. So I don't know if I would give it to children. Now, one of the problems is people treated this thing with standard azithromycin, like a Z-Pak. That's the best way to start antibiotic resistance because that's just not going to cut it. So resistance to azithromycin shut up. So it doesn't really work as well unless you use it in combination. I like to treat with doxycycline, and I usually start with 10 days of it, not 7. Remember, if you're going to treat it well. Otherwise, you could deviate it into being a resistant bug. And then if the doxycycline doesn't work, you can throw in a fluoroquinolone, such as moxifloxacin, and treat it for the standard therapy. Again, inappropriate antibiotic choice or inappropriate duration of treatment is the reason why a lot of people have resistance. So what you're seeing out there, people, is antibiotic resistance. So if you're dealing with it and it's not going away, maybe have your doctor run a sensitivity profile, get cultured, and have a sensitivity done. Anyway, thank you. This is Dr. Famuyiwa, and I hope that helps you.